My name is Sam. I'm in my final year of studying medicine at the University of Newcastle. And as I've gone through my degree, there's been an increased awareness of the challenges of mental illness for my peers as well as for junior doctors. So, how common is it? With advances in technology, modern medicine has treated a lot of diseases that were once untreatable. But mental illness is still a challenge and is actually a growing cause of morbidity, even in resource-rich countries such as Australia. And ironically, it's the doctors and medical students that have higher rates of mental illness compared to a lot of the population. In 2013, Beyond Blue's National Mental Health Survey of doctors and medical students found that med students were nearly 3 times more likely to report very high levels of psychological distress. And this extended to doctors as well, with an up to 10-fold increase compared to other professionals in Australia. Considering that this untreated mental illness and burnout can affect empathy and patient care, it's even more important that this disparity in mental ill health is addressed within medicine. But why is there this disparity? Well, apart from the risk factors for mental illness that can affect the general population, such as genetics, trauma, and substance abuse, medical students are exposed to unique stressors that increase their risk for psychological distress. And firstly, there's stigma. Whilst mental illness is definitely still stigmatized within the general population, medical students face added professional barriers to seeking help. In fact, the survey found that 40% of medical students believe doctors think that having a mental illness makes you less competent. And several studies and even recent news articles have highlighted cases of bullying of junior doctors, which has even led to some hospitals losing their ability to train doctors. This culture within the medical hierarchy and the long-standing attitudes towards the mental health field continues this cycle of stigma. And these negative attitudes around mental health creates barriers for students to seek help. There's also the perceived consequences on the student's career if they do seek help. The survey found that 37% of medical students thought that a mental illness could affect their career progression. This is compounded by the structural issues within our healthcare system, where some medical students can only be treated by doctors that supervise them, particularly in rural areas. Even if they do seek help, 49.9% of students are worried about their own patient confidentiality. So just as the cause of mental illness is multifactorial, there are several reasons for why medical students are at a higher risk for mental illness. So how can we make it better? Much like any other illness, there is no one-size-fits-all solution for mental illness. Particularly for medical students, mental health needs to be addressed at each level, at society, at university, and at the individual level. Firstly, we need to address societal attitudes. And there has been progress in mental health within society, with campaigns such as Are You OK Day and Movember. And largely this has been successful, with increased. But more needs to be done at a university level. Procedures need to change at university to foster a better learning environment. A 2019 consensus statement from medical education leaders from Australia and New Zealand identified 7 recommendations for medical schools to implement. These strategies, such as implementing mental health promotion, aim to destigmatize and improve awareness of mental health. Particularly, one key area includes ensuring a positive culture within clinical settings, which helps to address some of the barriers that medical students have towards seeking help psychologically. But these structural changes will still take time to change the culture within medicine. But if you're a student now, some strategies that are evidence-based to ensure your own mental well-being include trying to stay connected with friends and family, getting 30 minutes of exercise most days, avoiding substance abuse, and seeking help from people you're comfortable with, whether it be friends, counselors, the GP, university staff, or if you're acutely unwell, calling Beyond Blue or Lifeline, or even calling 000. Thank you very much for listening to my talk today, and I hope you have a lovely day.